Hello class, I'm going to be doing my presentation today on psoriasis, more specifically plaque psoriasis. According to the CDC, psoriasis is a chronic autoimmune skin disease that speeds up the growth cycle of skin cells. This means that instead of shedding like normally, the skin cells will pile up on the surface of the skin. This disease appears to be like thick, red, or silvery scales on the skin. They normally build up around the scalp, the elbow, and the knees. There are different types of psoriasis, but the most common is plaque psoriasis. Other psoriasis include psoriatic arthritis, which affects the joints of the body. And there is also nail psoriasis, which causes your nails to be rough and very damaged, and it's just an uncomfortable feeling for your nails. And there is also guttate psoriasis, which appears to be salmon-colored, pinkish-colored patches on the skin. And anyone can have psoriasis, but it's more common in adults. According to the National Psoriasis Foundation, symptoms for psoriasis include painful sores, itchiness, a burning sensation, joint pain, and inflammation of the body. There are also a lot of triggers that cause psoriasis patches to flare up, and the number one trigger is stress, as well as drinking alcohol excessively, dry and cold weather conditions, infection, and shaving. Stress affects the immune system a lot, so when a person with psoriasis is stressed, their immune system is going to be highly affected, which is going to cause more inflammation of the body. The patches created by psoriasis are very dry as well, so that causes them to be very, very itchy. And people with psoriatic arthritis are going to feel excessive and really, really painful and discomforting joint pain in their joints and their hands and their feet. Psoriasis is an autoimmune skin disease and is not contagious. Scientists and doctors are not sure how this disease develops, but they do know that the immune system and genetics play a big role in the development part. According to Dermavant Sciences, aerohydrocarbon receptor, also known as AHR, is essential in maintaining skin homeostasis. This receptor is present in immune cells, such as T cells and skin cells. This receptor is responsible for immune response, skin barrier function, and antioxidant activity. However, during psoriasis, this receptor is highly dysregulated. This receptor is also present in Th17 cells, which is a type of T cell, and with an individual that has psoriasis, this Th17 cell is going to produce an excessive amount of pro-inflammatory cytokines. So this is what causes the body to become inflamed and produce more skin cells in those scaly patches in plaque psoriasis. Treatments for psoriasis depend on the severity of the psoriasis that an individual has, but treatments include creams, ointments, ultraviolet therapy, drugs, and injections. The creams, ointments, ultraviolet therapy, those are more of like physical treatments that just make these scaly patches on the skin disappear. But the drugs and the injections and medications are more for the immune system to take in and stop that overproduction of skin cells.